So navicular syndrome is an issue with the navicular bone, that teeny tiny little sesamoid bone that's behind, or just, I guess, on the palmar aspect or plantar aspect of the hoof, so just right behind the coffin bone. It's called a syndrome. It's not a disease anymore because it's kind of variable. Clinical signs, they'll have these short, choppy strides. You might notice that while the horse stands, they point one of their feet or maybe point both. They tend to look like they're trying to walk on their toes and getting off their heels. They'll usually block out to a palmar digital nerve block, so that blocks out the back third of the foot. You may also find sensitivity across the heel bulbs with hoof testers. The risks: smaller feet, underrun heels, so poor shoeing and very upright pastern, so they're very straight up and down, which puts a lot of pressure on that back part of the hoof. Treatment, it's more of a management. So special shoeing is, you can rest them. You may not be able to work them as aggressively, but usually it ends up being a shoeing thing. They have to have shoes the rest of their lives. There's different ways to support the heel. There's also now another treatment that can be added to this list. There's a drug called osphos. It's a bisphosphonate that is supposed to, it's designed to stop the breakdown of the navicular bone itself. It's been pretty successful. It varies from horse to horse, but it can make them a lot more comfortable and still more usable. Some people choose to cut the nerve that goes to that area, so it's a nerve. It's called a nerving surgery. The problem with this is usually people who want to keep riding the horse. They say you can't, and so that way it can keep jumping, things like that. You have to be really careful. It's not a great idea. You shouldn't necessarily ride these horses. It ends up ruining the proprioception to their feet. They don't know where their feet are. They need to have shoes the rest of their life. And also, they could hurt their foot and you wouldn't know. So it's really something more of a salvage procedure. It might keep the horse comfortable in the long run, but not a great idea. Instead, it's more of a management. Some horses can be very successful and have long careers with navicular syndrome. Other horses are, their careers are ended up pretty short. It's one of the reasons that actually is the reason we have Haley, is because navicular ended her riding career. So here you can see this is the navicular bone. So this is the coffin bone. This is P2 coming down, and this is the navicular bone. And especially if you look at this area right here, you can see these are what we call lollipop lesions. So they're kind of little circles here. It ends up looking like something is chewed along the edge of the bone. Sometimes you'll see big circles or big cysts in the navicular bone. Cracks. So these are literally cracks in the hoof wall. They can be minor to incredibly severe. You'll hear them called sand cracks, toe, heel cracks, and quarter cracks. It's a result of dry, brittle hoof, the horse being outside in all kinds of weird weather, mud, too hot, too dry, too wet, too this. It can end up being very painful and even go all the way up and cause injury to the coronary band. Pretty much shoeing, sealing the crack, regular trimming. You can try things such as topical treatments to help nourish the hoof, also hoof supplements to help it grow out. But really, it's just a management thing and trying to keep them in good hoof environment. Greasy heel, so also known as scratches, chronic seborrheic dermatitis. This is this really nasty infection that sets up on the surface of the pastern, often in muddy conditions. It can be really hard to get rid of. Some horses, you never get rid of it. You have to be relentless. It seems like once they have it, they continue to have it. There is somewhat of an immune aspect to it. So treatment: clipping the hair, cleaning it using antiseptics. People make all sorts of little cocktails out of a mixture of steroids and DMSO and antibiotics and antifungals, which does seem to help. My history is really severe cases. It ends up seeming to come back. They can be very painful, and also a horse can end up getting an infection in the leg, cellulitis, which requires long-term antibiotic treatment and NSAID treatment. Seedy toe, so this is separation of the hoof wall. It can occur secondary to laminitis. You just have to pare out the area and pack it with ichthymol to try to clean everything out. Side bone, so this is when the collateral cartilages, these cartilages here on either side of the hoof, they can ossify. We don't really know why it happens. It can be riding on hard surfaces, injury, conformation, sometimes time. Most of the time, I'd say 75 to 90% of these cases, you will find a side bone on radiograph is just a random finding. There are a small amount of cases where it does produce pain. Okay, treatment is rest and NSAIDs if they are indeed painful. The one disease that isn't here that should be, and then I'm going to add real quick, is ring bone, not to be confused with side bone. Ring bone is when they actually start having the ossification of like arthritic changes in ossification around usually the joint areas. You can see I'm circling here around where P1 meets P2, P2 meets P3. This can be incredibly painful, and in this can be career ending. It can also happen secondary to riding on hard surfaces. Sometimes you can palpate the change. All of a sudden you'll start feeling this hardness around the joint surface. You can, again, joint injections can help, pain meds can help. Some people will even do injections to with alcohol to actually cause ossification of the joint. The horse will have a permanent stilted gait or lameness, but they won't be in pain anymore. So don't confuse ring bone and side bone. Ring bone is, in general, the more serious of the two. So other musculoskeletal injuries, as you can see, the list goes on forever. A lot of these happen secondary to too much work. Rest can be helpful. These are things you'll all find out. We'll talk about a few of these. So buck shins, inflammation of the periosteum of the dorsal cannon bone. So from intense training of young horses, they can be lame on pain and palpation, and rest is the main thing. Some people used to do that, the fire pinning, where they would, pin firing, where they'd stick it with hot pins to try to increase blood circulation and healing, but really it's all about rest. So pin firing is not recommended anymore. Splints, or abnormal bone growth on the splint bone, so that P4, or sometimes the cannon bones. Often they've whacked the bone, or they've had some kind of strain or trauma to the interosseous ligament. And sometimes they're not lame at all. Sometimes they'll have this subtle lameness. You'll find pain at the surface of the cannon bone. Treatment, again, is rest. We've also found poulticing and bandaging can help. And it will resolve, and sometimes, though, you have a bump at the site for the rest of their life. So here is a splint forming right there on the inside. This is one of the reasons bandaging. There's splint boots, polo wraps, or exercise bandages can help prevent this. Sweeney, so this is atrophy of the shoulder muscle right here, usually caused by damage to the nerve, especially if the horse whacks their shoulder walking out of their stall. There's no actual treatment. The nerve can heal, and sometimes it can improve. Steroids, sometimes gabapentin, things like that can help, but it's usually just time. And if the nerve does fully heal, then they can go back to normal, but there can also be permanent nerve damage, and that muscle will never be quite right again. String halt. So this is a strange flexion of the hock during forward movements. We don't really know why it happens. Treatment is surgery, sometimes also just mild forms you can treat with exercise, hill work, taking them up hills, things like that, chiropractic, acupuncture work, but often surgery to help to reduce the strange movement. Oops. You can see that very hyper movement. That's the string halt. Here's a whole list of other things. Here I was talking about the ring bone, but that should be back on that old slide, and you can read through this at your time. If you have any questions, let me know. Exertional myopathies. So this is a group of diseases that cause muscle cramping, fatigue, and pain. It's associated with exercise. The most common one is exertional rhabdomyolysis. It's similar to the rhabdo that people can get, but it's actually a very serious necrosis of skeletal muscle. You'll hear it referred to as tying up, or sometimes Monday morning syndrome. Weekend warriors go out, gallop their horses all weekend long, and then the horse can barely walk on Monday. Clinical signs are muscle cramping, refusal to move, increased respirate and heart rate, excessive sweating. Their muscles and their hind end especially become so tight. In severe cases, myoglobinuria, they'll end up having this breakdown and their urine will look like blood. Signs are elevated CK, so muscle enzymes, and AST. Rest, anti-inflammatories, fluids, sometimes muscle relaxants to help, but you have to be careful because kidney damage can be a sequela to this, to severe rhabdo. Equine polysaccharide storage myopathy, EPSM or PSSM. This is something that's genetic in quarter horses, draft horses, and warm bloods. Has to do with glycogen storage. It can look similar to rhabdo. It causes the sweating, hind limb stiffness, abnormal gait, and reluctance to move. It can also be diagnosed by blood work, muscle biopsy, along with genetics. Treatment is actually limiting their starch intake, so making sure they're on more high-fat, low-starch. And be careful, exercise is actually good for them, but you want to gradually increase it, give them long warm-ups, etc. And that is it for equine diseases. Thank you. If you guys have any questions, please post in the forum and I will get the quiz up for you to take by end of quote-unquote class time Friday. Thank you very much.